Hello YouTube land. Starla here again. I have put this off and put this off because I really just don't feel like doing this right now. You can see my appearance is starting to change. My face is rounder, fatter, puffier. That's because of the prednisone that they put me on for the autoimmune hepatitis so that my liver doesn't fail. So that turkey thing is really, really pronounced now. Oh my God. I can't get rid of that stupid thing. As many of you know, we've had kind of a hiccup in the medical sphere, of course, of all things. I recently had surgery on my knee because, I'll show you, you can't see anything. It's just my gauze, just the bandaging here. And actually it's kind of a makeshift because I'm in between ordering new dressing from the hospital. So it looks really messed up because I did it myself. It's really the redneck. But there's stitches under there that it's really bad. I want to scratch them so bad. And some of you have seen the pictures. They're on my Instagram, my Facebook, if you're on there. What happened was, the full story is this, that over a year ago, I ended up with cellulitis in my leg. And you can actually see the scar. That's one of the scars here. Looks kind of like a gunshot wound. But it's really nasty and brown and yeah, almost like, I don't know, if you look at it really, really close, it almost looks like a nipple or something without the bump, the ridge. But, so I had cellulitis and, because the whole thing is, I was back in West Virginia in Martinsburg, and the political landscape there with the whole heroin problem, none of the doctors will really take you seriously if your main concern is pain. They will generally send you to, you would have to go to your primary physician. Doesn't matter what insurance you have, doesn't matter. This is not about insurance. It's about the doctors themselves and what their attitude is towards pain patients. Generally, you would go to your primary care physician and they would recommend or refer you to a pain management clinic. And then they would, whatever, deal with you there. But generally speaking, they would examine you and diagnose you with some kind of whatever before determining that that's what you need. Now, my primary care physician never examined me to find out whether or not that was my problem, like it was chronic pain, if it was from side effects of medication, she never did anything. So we knew that I had this cellulitis. And what she told me, now, 3 different doctors saw this cellulitis, right? 2 were in West Virginia, 1 was here in Pittsburgh. Now, the one here in Pittsburgh was my liver doctor, and she had nothing to do with it. She knew it was cellulitis. In fact, she was the one that called it in the first place. When I had this surgery for a staph infection, and they did an IND for this, and that's when they found the cellulitis, she said that's what it was, cellulitis. And I guess they listened to her, but they didn't take it any further than that. My primary care physician, as well as my oncologist, completely ignored it. Totally. My primary care physician said to keep antibiotic ointment on it and keep it wrapped. In fact, I actually have a video that I'll link in the description showing myself doing that, showing myself taking care of that wound, the scar that I just showed you, and it is disgusting. I'll just tell you that. You can't see the bone, but it's amazing you can't see the bone. Because it ate through my skin to my bone, which is what landed me with this mess. So we knew that I had the cellulitis. Well, it took months to heal that, or it didn't even actually heal, apparently. But it took months for that skin to heal over and scar up and everything. So during the time, I'm going to tell you something. The pain from that, from cellulitis, is so bad that I can't even describe it. It was just on my skin. It just felt like my skin was on fire. It was terrible. Excuse me. But so the skin healed over. So I thought, not really knowing anything about it, I thought that it was healed, that it was fine, right? But then I started to get a pain in my knee a couple months later. Not even a couple months, maybe a month later. And I couldn't figure out what it was. And at the time, I was on prednisone. So I thought maybe it was a side effect of that. Like the prednisone was, even though prednisone is for anti-inflammatory action, I thought maybe because it had done other crazy stuff on my body, that it was just doing the opposite and making my knee flare up or whatever, you know, like inflaming my knee somehow. So we just kind of went with that, and I put ice on it. I took extra tramadol and like ate freaking ibuprofen like they were candy. And it just, like, I went to the doctor, and my primary care physician, she's just like, you know, just keep ice on it, and, you know, I don't know what to tell you other than, you know, I can send you to the hospital to the ER for an x-ray, but it doesn't look like, if you haven't fallen and there's no injury, it doesn't look like there's anything wrong with it. It would probably be for nothing. And so she did nothing, basically. And so then I was off the prednisone, and I was on chemotherapy, and that the only thing that my oncologist was worried about was that it didn't come from the chemotherapy. Like, he was very, very defensive about the chemotherapy not causing anything. Like, he tried to tell me it was benign and that it didn't cause any horrible side effects, which was complete BS, because it did. And I didn't realize that until I was off of it. But in this case, that's not what happened. That chemo obviously did not cause this. But that's the only thing that he was worried about. The only thing that he would talk about was, in terms of my knee, was that it didn't come from the chemo. So that was that. And I was basically stuck. Like, nobody would do anything about it. Nobody would help me. Nobody would examine me. Because my primary issue was pain. They treated it like I was looking for drugs. And that is the climate, the political climate in that area of the country right now, and has been for years. Because the heroin problem is so bad. And it got bad because of doctors over-prescribing. And, I mean, that is one aspect of it. But that is, like, if you go in for pain, for the ER, your doctor, a specialist, whatever, it doesn't matter. Unless it is to your primary care physician to be referred to pain management. That is the only exception. And even then, they are so strict that, I mean, you have to jump through hoops of fire just to get anything with pain management. So it's really like this whole cracking down thing. This is the other side of it. I'm on the receiving end of their attitude, their prejudice, their bias, that everybody coming in with pain is looking for drugs. So I went a good year with this pain, and it was on and off, on and off, on and off. And then, like, I come off the chemo, and we move up here to Pittsburgh, and it stops. Like, all the pain stops, the swelling stops, everything. So my thought was that it really did come from the chemo, But then that didn't make sense because I was like, well, it started before I started chemo, so I don't understand how that works. But I was satisfied to not be in pain and to not have to limp around everywhere and eat over-the-counter stuff and, like it's candy and ruin my kidneys or my liver or whatever, with these anti-inflammatory drugs. And so then about 2 weeks ago, it started hurting to the point where I couldn't stand it. And I don't know what aggravated it. I don't know if it finally got to a point where it started to work on my nerve endings in my knee. I don't know what happened. I don't know what the change was. I have no idea. But it got to the point where I was like, Mom, I cannot stand it. Like, it was waking me up. I couldn't sleep. I mean, it had woken me up before, and I would just go and get an ice pack or whatever, and then go back to sleep. But it was to the point that ice was not doing it, heat was not doing it, ibuprofen was not doing it, naproxen, Aleve was not doing it, Advil, whatever, Tylenol. I even got desperate. I'm not supposed to take Tylenol because of my liver, but I got desperate and took Tylenol, and that usually, because I don't take Tylenol, usually if it's really bad, it will work, but it didn't work. Nothing worked. No tramadol, nothing. I even mixed my tramadol with my Klonopin, hoping that maybe it was psychological, like I was freaking out, and I mean, it made me sleepy. I didn't take enough of it to be a danger to myself, but it made me sleepy, but I was still in pain, and I couldn't sleep. So my mom took me to the urgent care on a Sunday. I made her go to church before because I was like, it's so stressful. The medical stuff is just getting so stressful, Mom. You just need a break, and we were to the point where we were at each other, so I was like, you just got to go. You got to go to church, enjoy yourself, and we'll deal with this when you come home. So when she came home from church, we went to the urgent care, and they couldn't do anything for me, but they said I needed an x-ray. So they sent me to Shadyside, UPMC, and the ER, and they took me right in. They did the x-ray, and they were very shocked by what they saw. They went from telling me it was, good Lord, 2 types of cancers to telling me it was a staph infection. There were medical students. There were problems, okay, within the staph because there were medical students there, and they kind of made everything worse because they were like a diagnostics fellowship. If you think of like the show House, it's kind of like that, but these were really, really young medical students. I mean, they looked like high school kids. They were so young. And I mean, you get somebody that age in medical school and they think they know everything, so, and here I am in so much pain that they can't give me any more medication. I mean, I was screaming, crying in pain, and the more they messed with it, the worse it got, and it just was like, just do something, cut my leg off, I don't care, just do something. And so they said that it was an infection. They got the cultures back and everything, and it tested positive for staph, negative for MRSA, so that was a good thing. But they couldn't figure out where it came from, just like with this thing. They couldn't figure out where it came from. And the only thing they could say was that because I was immunosuppressed, because I took medication that suppressed my immune system, I was vulnerable to certain bacteria, and staph grows on our skin. So, of course, see, I didn't connect the cellulitis yet. It was still up in the air as far as where it came from. But, so the staph grows on our skin. They were just like, you're just vulnerable. This is a weakness of yours. You're going to have to deal with this for the rest of your life probably. But this is a really, really severe case of it. So they did a biopsy, they did the cultures. Oh my God, the biopsy was so bad. Oh my God. Like, there was no pain worse than when they opened that pocket of pus. It's gross to talk about it. I didn't see it, obviously. They gave me fentanyl. I had to be awake because they said they were afraid to put me to sleep because I had had so much medication, so much pain medication at that point, that if they put me to sleep, I may not wake up because I'd stop breathing. And they didn't want a chance to risk that. So, yeah, so I had to be awake for that. And they gave me fentanyl to help relax me, which didn't, because I was just in so much pain that it just didn't matter. And a local anesthetic, which was okay until they pierced the pocket and everything came rolling out. And it hurt so bad that my whole body flinched and I came off the table. Like, I didn't jump off the table. I didn't move. Not willingly. But like, all I could think, I cannot form a coherent thought. I could not articulate words. The only thing my brain and my body was thinking or feeling was pain. And it, like, I can't even describe the pain. It was just this piercing electrical current, volt, whatever, that went through my entire body. And it just hurt so bad. And I just screamed out. And there was nothing that they could do. I mean, they said that it was a lot of pus. It was just pus and that's it, but it was pus everywhere. And they got so much of it as a culture, as a sample that, I mean, it was just coming out. Like I don't know if they had to they didn't drain it. I think they sucked some of it out during the biopsy because it was just so much. But it had literally eaten my bone, my tibia bone, from the inside, and it came from right here. Like, this is the top of my tibia bone where they did the thing, right? Well, the cellulitis was right here. That's where it came from. So it traveled that distance. I mean, it had eaten that much of my bone. And they actually, in the surgery, had to put cement type things, like cement type artificial bone or whatever inside my knee, inside my bone, so to hold it together so that it didn't fall apart when they were getting all of the infection and everything out. So yeah, and I actually might have to go back in 6 weeks and have another surgery to have that removed. So I don't know exactly how that's going to work. I remember they mentioned it before I went into surgery, but because I was jacked up on pain medication, it's hard for me to remember exactly, you know, what I have for the future here. And so that led to, I'm sorry, I have to keep this like in here, but this is actually my antibiotics, and it's an IV antibiotic. This is how bad it was. I mean, I literally almost lost my leg. I could have died if I waited any longer because I could have gone septic. In fact, there was a guy next to me, in the room next to me, who was septic, and I had to hear him throw up for 24 hours. I mean, it was like, oh my God. I didn't know that if he was going to make it because it was so bad. But anyway, this is IV medication. This is IV antibiotics. It's oxacillin. It is a wide range, broad spectrum antibiotic, so it takes care of most things. And the infectious diseases doctor actually prescribed this for me, and I had to take it for 6 weeks, and that is every day, 24/7. I have a port. I'm sure I've showed you guys. See right here, that's where it's connected, my medical port. It is IV. It has to be because it's so strong. I can't take pills or whatever. It has to be IV medication around the clock for 6 weeks. That's how serious this was. And the fact that it didn't go into my bloodstream really says a lot. Because at first they thought, because they got a positive culture, for staph on my port, and a positive culture for staph on my leg, and they thought that it came from my port. But we were using my port the whole time, and I wasn't septic. Like, I had no symptoms of being septic at all. And so no fever, no chills, nothing. Like, I wasn't sick. I mean, I sound sick because I have a cold, and this actually is making me hoarse and changing my voice. Not to mention the prednisone does that too. It changes my voice. It makes me sound like I'm got a frog in my throat. But, I mean, that's just normal. It does it to me every time. But that ended up being contaminated. They determined that that was contamination, and my port was not positive for staph, so I was not septic, and so that just increased the mystery of my leg. But so yeah, I have to do this, and I have to change this every day, every 24 hours. It's a self-deflating thing. It's like a little ball in there. It has like you see the coating around. It's like a plastic coating, but inside is a little plastic ball, kind of filled with fluid. So this, when it's done, will look like more of a instead of a ball, it'll deflate and look more like a cylinder, I guess, when it's, time to be changed. But yeah, so I have to do this for 6 weeks, and I may have to go back in for another surgery, so I don't know, reconstructive surgery or whatever. But I'm grateful that I have insurance now, and that whatever that I just had done was covered by Medicaid, the Pennsylvania Medicaid access. But tomorrow my real insurance will kick in and take over. So, and that's all through UPMC. So, and all my doctors are at UPMC, so it works out. I don't really have a problem. So anyway, so I talked to the infectious diseases doctor after everything. In fact, it was the day that I left, that I went home, and I told him about the cellulitis a year ago, and he put it all together and said that's where it came from. I mean, obviously, you've had this for a year. That's why it's so bad. And that's why it kept coming back and going away, coming back, going away. And it didn't make any sense. And, that the only thing that healed on my leg was my skin, but really the infection went into my body and into my leg and into my bone. So, yeah. So that's what happened. If you could follow that. And I'm still not out of the woods, because now I am laid up. I can show you, I have a walker. I have to walk with that. I actually ordered a pair of crutches so I can be more mobile, because we're supposed to go home for Christmas, for the weekend, of Christmas, me and Mom, and I need to be more mobile and, walking around and everything, getting around, because this thing it's okay, I guess, for being at home, but I really, really pity the people who have to use them out and about. Because I can't even go outside right now because it's snowing, or it did snow. I can't take these down the steps. It's just impossible. I have to use a crutch or a cane to get up and down steps and use the railing. I'm not supposed to be on this for 6 weeks. I can't put... They said 50% weight, the physical therapist did, but O'Malley, my surgeon, said nothing. He's like, don't bear weight on it, because he said if you shatter it, I can't fix that. So, if I fall, if I put too much weight on it, anything like that, and there's already... You can't see it from that direction, that angle, but I can see there's like kind of a bump in it from where, I guess, they said they had to cut my muscle in half because it was so inflamed and they couldn't get around it to get to the bone. So I'm guessing that this bump here is from my muscle, them sewing it up and it healing. So, I mean, they just kind of ripped their way through, and, you know, it's really, it's quite amazing when you think about it, how surgeons do that. And I didn't feel a thing. They did at least wait till the next day to do the surgery because of the medication that I was on when I went in there and for the biopsy and everything. Well, I think they might have waited like 2 days. I don't know if it was Wednesday or Thursday that they actually did the surgery, but I think it might have been Wednesday. I don't know. It's all a blur because I was so, like, they had me on Dilaudid and oxycodone, you know, alternating Dilaudid, oxycodone, because it was so painful, because it had eaten everything in there. So that included nerve endings and all that stuff. And I mean, you know, nerves. Hello. So I was just really out of it for a whole week. And I don't know, like, when I think about surgery, I think about, like, I had this Alice in Wonderland experience. Like, I was tripping out. Whatever they gave me made me experience this Alice in Wonderland high. / being out for surgery. Like, I don't know. I don't think I went anywhere. People say, like, they have out-of-body experiences when they have surgery or whatever. I didn't have that. I was Alice, and I was in Wonderland, and I was having a great time. But that's, yeah, so coming to was not very cool. I mean, that wasn't a very good experience. But it was just, I don't know, that was weird. That was it's kind of a blur. I just remember bits and pieces of it. But I remember talking to the woman in charge of the department, and I was just like, where am I? Like, what just happened? And she's like, you just had surgery, you're in the recovery room, you'll be okay. I'm like, I thought I was Alice. I was in Wonderland. But anyway, so yeah, that was my experience, and that's what's happening now. I have a nurse coming in every week to change my port out and to get blood and to help me with bandages. I mean, he came like the first 2 days and he switched this out for me. And then he switched my bandages, and then he just showed me how to do it. So I do that every day. And then on, you know, during, or every 7 days, every 5 or 7 days, he comes and cleans this and re-accesses it. I think it's every 5 days. And because, you know, you can't really have, it gets dirty after a while. It gets, I mean, it's just more sterile to change it out and to clean around the area and all that stuff, because you can get staph, because staph does grow in the skin. And, you know, you're taking showers, you're, you know, changing clothes, and you're washing, and, you know, you have your sponge baths or whatever, so you're washing around it, and, I mean, it just, stuff gets on it, around it, whatever, and you gotta clean it. And then this is just a dry bandage change here. I don't put anything on it. I just wipe it down with alcohol and change the bandage. So it's dry and healing and, you know, all of that. And that's what I was instructed to do. So, but as far as like everyday activities, right now we're looking to get some help for that, because Mom tried to help me with showers, and then we had like a swimming pool on the floor. We have I have actually a shower seat, or a transfer bench is what I have, because I can't put weight on this, so I had to sit down and, you know, get into the bath or the shower and sit down and have my shower like that. And it's really hard not to get water on the floor and all, you know, it's just difficult. just be grateful for your mobility. Be grateful you can walk and use both of your legs if you can. And it's just one more thing. Just slow me down and say, hey, Starla, you are blessed even if you have absolutely nothing to your name. You are blessed just to have the health that you have. So, yeah, anyway, I'm going to get off here because my mother is coming through the door. And we have a lot to chat about, I'm sure. And so that's the gist. That's what happened. And I will see you guys on the flip side. Bye.